First, the PT demonstrates the exercise for the patient. The patient stabilizes herself against the wall using her arms. While keeping her feet in good alignment to prevent the use of her TFL, she concentrically contracts her left gluteus medius as she raises her right hip. The PT places her hands on the patient's pelvis to ensure pelvic stability. To progress this exercise, the PT adds a physio ball. Again, the PT demonstrates the exercise for the patient. With the PT stabilizing as needed, the patient pushes the physio ball into the wall while using her arms as a stabilizer. Keeping the hips neutral, she lifts and rolls the ball up the wall. The last progression in the gluteus medius exercises is a pelvic drop. The PT first demonstrates for the patient. The patient stands on her left leg and lowers her right off the step and raises her leg back up. The PT stabilizes the patient for balance. This exercise works the gluteus medius concentrically and eccentrically. These exercises help improve pelvic stability during single leg stance, which will translate into functional activities such as walking, running, and stair climbing.
To begin stretching the IT band and strengthening the glute medius, the PT will instruct patient on how to do frontal plane lunges. Patient stands with feet shoulder width apart, knees slightly flexed, and abdominals drawn in. The patient steps to the 9 o'clock position until she feels tension in the gluteal muscles and the lower extremity, and then immediately returns to starting position. A medial reach will then be added, which causes increased activation of the pronators of the loading leg as a result of the internal rotation on the distal lower extremity during the reach. The patient will then be instructed on how to do a wall banger exercise. The patient stands 6 to 12 inches from the wall, with left side closest to the wall. It is critical that the patient does not hold the reaching position, as this removes the elastic recoil tendency of the muscle and removes the eccentric loading required in this movement pattern. Starting from a stand tall position, patient reaches out towards the right. As the patient reaches, she should rotate the hips towards the right foot, flexing the knees, dropping the hips, and maintaining a neutral lumbar spine. The patient lets her left hip bang into the wall, giving her tactile feedback, then immediately returns to start. Finally, patient will perform frontal plane lunges with a contralateral reach. This movement pattern causes greater activation of the supinator muscles of the loading leg as a result of external rotation of the distal lower extremity during the reach. All of these exercises will increase strength in the patient's hip abductors and external rotators, as well as stretch her IT band. This will enable her to have a more stable pelvis and contribute to her return to pain-free walking and running.
In this return to running exercise, the patient will be instructed on practicing her running form with reciprocal arm swings without any resistance. The patient will focus on hip extension and pull-through while being reminded to not allow her hip to drop excessively. When the patient feels comfortable with this motion and is able to maintain form, resistance can be added through the use of different color TheraBands. The TheraBand can be placed above the knee while the patient is concentrically pushing into extension as the PT stands in front to work hip extensors. The patient is then instructed to turn to the side as the TheraBand is lowered below the knee to increase resistance and is told to maintain proper running form. The PT will use the TheraBand to pull the patient's leg into adduction, and the patient uses her hip abductors to resist this motion. The PT can apply resistance from behind the patient to concentrically work hip flexors and eccentrically work her hip extensors. Lastly, the PT can apply resistance into abduction while the patient uses her hip adductors concentrically and her hip abductors eccentrically. This exercise will strengthen hip muscles in all directions and is a functional movement pattern that will allow her to return to running.